Here are 15 Puerto Rico Medical Board-style clinical vignettes focused on immunologic disorders, hypersensitivity, autoimmune diseases, and immunodeficiencies, each with 4 answer choices and explanations. Immunology, clinical vignettes, hypersensitivity, autoimmune diseases, and immunodeficiencies. Hypersensitivity reaction. 1. Type 1 hypersensitivity. Anaphylaxis. A 22-year-old woman with a history of severe peanut allergy develops wheezing, hypotension, and urticaria within minutes of eating a peanut-containing granola bar. Which of the following best describes the mechanism of this reaction? A. Cytotoxic T-cell destruction of mast cells. B. Complement activation via immune complex formation. C. IgE-mediated mast cell degranulation. D. T-cell activation against food antigens. C. IgE-mediated mast cell degranulation. Type 1 hypersensitivity involves IgE cross-linking on mast cells, leading to histamine release. 2. Type 2 hypersensitivity, autoimmune hemolytic anemia. A 45-year-old man with chronic lymphocytic leukemia CLL presents with fatigue and pallor. Labs show low hemoglobin and a positive direct Coombs test. What is the underlying mechanism? A. T-cell-mediated destruction of RBCs. B. Deposition of immune complexes in small vessels. C. IgG and complement-mediated RBC destruction. D. Histamine release from mast cells. Answer: IgG and complement-mediated RBC destruction. Explanation: Type 2 hypersensitivity involves IgG binding to self-antigens, e.g. RBCs, leading to complement activation. 3. Type 3 hypersensitivity, serum sickness. A patient receiving infliximab for Crohn's disease develops fever, rash, and joint pain 1 week after infusion. Which of the following best explains the pathogenesis? A. Immune complex deposition in tissues. B. IgE-mediated mast cell activation. CD8 plus T-cell-mediated destruction of target cells. D. T-cell response against foreign proteins. Answer: A. Immune complex deposition in tissues. Explanation: Type 3 hypersensitivity involves antigen-antibody complex deposition, e.g. serum sickness. Type 4 hypersensitivity, contact dermatitis. A construction worker develops an itchy erythematous rash with vesicles on his hands 48 hours after wearing new latex gloves. What is the most likely mechanism? A. Mast cell degranulation. B. IgG-mediated cytotoxicity. C. Immune complex deposition. D. T-cell-mediated response. Answer: D. T-cell-mediated response. Explanation: Type 4 hypersensitivity, e.g. contact dermatitis, is delayed and mediated by T-cells. Autoimmune diseases. Systemic lupus erythematosus, SLE. A 30-year-old woman presents with malar rash, arthritis, and nephritis. Lab tests reveal positive ANA and anti-dsDNA antibodies. What is the primary mechanism of tissue damage? A. T-cell-mediated destruction of self-antigens. B. Deposition of immune complexes. C. IgE-mediated mast cell degranulation. D. Autoantibody-mediated complement activation. Answer: B. Deposition of immune complexes. Explanation: SLE is a type 3 hypersensitivity disorder involving immune complex deposition. 6. Rheumatoid arthritis. A 55-year-old woman has morning stiffness in multiple joints lasting 1 hour and symmetric swelling of the MCP and PIP joints. What is the primary pathogenic mechanism? A. T-cell activation and synovial inflammation. B. Deposition of urate crystals in joints. C. Immune complex deposition in synovium. D. Anti-DNA autoantibodies attacking synovium. Answer: A. T-cell activation and synovial inflammation. Explanation: RA involves chronic synovitis due to T-cell activation and cytokine release. Type 4 hypersensitivity. 7. Multiple sclerosis. A 35-year-old woman presents with optic neuritis and limb weakness. MRI shows white matter demyelination in multiple areas. What is the primary mechanism of disease? A. IgE-mediated mast cell activation. B. T-cell-mediated destruction of myelin. C. Deposition of amyloid plaques. D. Autoantibody-mediated destruction of neurons. B. T-cell-mediated destruction of myelin. Explanation: MS is an autoimmune demyelinating disorder mediated by T-cells. 8. Goodpasture syndrome. A 25-year-old man presents with hemoptysis and hematuria. Lab tests reveal anti-glomerular basement membrane antibodies. Which hypersensitivity reaction is responsible? A. Type 1, B. Type 2, C. Type 3, D. Type 4. Answer B. Explanation. Goodpasture syndrome involves type 2 hypersensitivity, antibodies targeting basement membrane. Immunodeficiencies. 9. X-linked agammaglobulinemia. A 3-year-old boy has recurrent bacterial infections with absent B cells in peripheral blood and low immunoglobulin levels. What gene is most likely mutated? A. BTK, B. RAT1 reggae 2, CD40LD, NADPH oxidase. Answer A. BTK. Explanation. BTK mutations cause a block in B cell maturation, leading to agammaglobulinemia. 10. DeGeorge syndrome. A newborn presents with hypocalcemia, recurrent infections, and congenital heart defects. What embryologic defect is responsible? A. Failure of second and fourth pharyngeal pouches. B. Failure of third and fourth pharyngeal pouches. C. Mutation in CD40L gene. D. Defective IL-2 receptor signaling. Answer B. Failure of third and fourth pharyngeal pouches. Explanation. DiGeorge syndrome results from defective thymus and parathyroid gland development. 11. Severe combined immunodeficiency CE. A 6-month-old infant presents with chronarrhea, thrush, and recurrent infections. Genetic testing reveals a mutation in the IL-2 receptor gamma chain. What is the primary immunologic defect? A. Defective B cell activation. B. Absence of both T and B cells. C. Defective NADPH oxidase activity. D. Failure of VDJ recombination. Answer B. Absence of both T and B cells. Explanation leads to severe defects in both B and T cells, often due to IL-2 receptor mutations. 12. Chronic granulomatous disease, CGD. A 7-year-old boy with a history of recurrent Staphylococcus and Aspergillus infections has a negative nitroblue tetrazolium NB test. What is the defective enzyme? A. Myeloperoxidase. B. NADPH oxidase C. Lysosomal hydrolase. D. Neutrophil elastase. Answer. NADPH oxidase. Explanation. CGD results from defective NADPH oxidase, leading to impaired phagocytic killing.